Hey guys, thanks for downloading the True Sports Physical Therapy podcast. I learned more during this conversation about athletic training than I ever knew, and it really helped me understand the profession. Today we have Dr. Kendra Lennon. She is dual certified athletic trainer and doctor of physical therapy. She runs our busiest clinic here at True Sports Physical Therapy, so we'll get into how she does that and how she has done that. She has her bachelor's in athletic training from the University of Vermont. She got a master's in anatomy, as well as her doctorate of physical therapy in 2020 from the University of Delaware. She is also the athletic trainer for Mexico men's and women's lacrosse, as well as Hungary men's lacrosse. Like I said, she's the clinic director in Timonium, True Sports Timonium. She's also the athletic trainer for the Maryland Lacrosse League. This woman does so much with her day-to-day. She really made me feel like a serious underachiever, but I've learned a tremendous amount from my conversation with Kendra. Please share this conversation with Kendra, with all of your PT buddies, with all of your athletic training buddies. Let us know what you love. Let us know what you want to hear more of. Can't wait to get some of your feedback. Hit us True Sports PT on Instagram. Without further ado, here's Dr. Kendra Lennon. And welcome back to the True Sports Physical Therapy podcast. Dr. Kendra Lennon, fresh off a trip from
Boston, Massachusetts.
Boston, Massachusetts, where you were working with?
The national lacrosse team for Mexico and Hungary.
So I love that because it dovetails into what we're going to talk about today. You are both a doctor of physical therapy and a certified athletic trainer, or an athletic trainer certified, ATC, right?
Yep.
So I want to dig into all those things, what it's like to be both a DPT and an ATC. Tell me about how you merge those things together in your current practice.
Yeah, honestly, at this point, I think I'm just me, and I'm both an athletic trainer and a physical therapist. A lot of people ask me that question, and I don't have a great answer for them because I don't really know how to separate it at this point. At this point in my career, it's kind of all the same. But I definitely think that I pull from both my backgrounds and use those skills every day. Both I work full-time, as you know, at True Sports, which is a physical therapy clinic. But then on the side, I'm off covering games and covering teams, which is more the athletic training side. So kind of use a little bit of everything every day.
And I love hiring PT, ATCs, dual credential. But the reason I love doing that is because I have yet to come across an athletic trainer, I would say, by and large, that is not a freaking hard worker. So you are a testament to that because you're such a hard worker, and you're coming off a flight that you took a weekend to go cover Mexico lacrosse, to go cover Hungary lacrosse, and now you're back to playing physical therapist. So how do you merge those things together in your everyday practice?
Yeah, I mean, I think I just take the skills that I have from those, and I don't really separate them. You know, I take all my experiences of this weekend of thinking quickly and being on my feet and using the resources around me and what I have in those circumstances. And then when I'm met with a challenging situation in a more stable environment, like a physical therapy clinic, that's awesome because then I can really explode and expand on that in my practice. But if I'm hit with a road bump, it's no biggie because I've already just, like you said, 4 days of, being on a grass field in the sun, which is a bag and all my stuff. I'm working through there, but then vice versa, on the sideline, I'm able to think back to all the stuff I do in the clinic and pull some of those resources, and it lets me prep a little bit better, bring some extra supplies to help make sure that I'm not just keeping them from not dying, but keeping them thriving and really performing well.
So it's interesting because I just did a podcast with Jamie Moore. He's a PT up in Jersey. He was talking about how he wishes we taught PTs how to be critical thinkers, just to be quicker on our feet, better diagnosticians. And we brainstormed about how we could do that in the PT curriculum. AT curriculum is actually a great precursor, a great way to teach you how to think critically because you're always on your feet, like you said, and always thinking rapidly. I'm sure that carries over beautifully to the clinic. Let's talk about professional sports because that's where I come across a lot of athletic trainers in professional sports. And so it always boggles my mind as an arrogant PT that I am to look at the way professional sports is kind of lined up or set up. And they love having athletic trainers as their director of sports medicine. Why is that?
I mean, why not?
Here's why not. Great question. We are QTs. We understand how to rehab and take an athlete from post-op day one all the way back on the field. We have 3 years of graduate education. We spend all these different affiliations learning the different facets of sports medicine. I look at it and you're like, why is a PT not in charge of that? Why is an ND not your director of sports medicine? Time and again, it's your AT. Make the case for why it should be an AT.
Well, I think especially in a sports setting, the athletic trainer is one of the only people that will be there from the exact start to the exact end of an athlete's process during injury, because they're the ones on the field. If someone gets hurt, the first person looking at them is an athletic trainer. So they're in that moment. That's an opportunity a lot of physical therapists don't have. So that almost like triage moment of where you're seeing, like in live play, what is going on, like how they're responding, how it happened, what is their initial presentation. That's the athletic trainer. And then for the role the athletic trainer has, especially in that director position, is to help progress them through. And that's pulling in the physical therapists and the MDs, but truly it's the athletic trainer that's responsible from that initial start, working with the other disciplines and then getting them back into play. And so that's why I think actually that's a great position to have an athletic trainer. I think they have that perspective because that is, in a sports setting, what the definition of that role is.
So great answer. That makes a lot of sense. Kind of changes my mind about that a little bit. What about now in 2025 with what PT looks like, is able to do? Oftentimes a PT is on the field. What about a PT SCS? Does that change your mind at all? SCS, yeah. SCS. Does that change your mind at all? Like, hey, a PT can do that also. Why are PTs not in charge of this?
I think yes, but with some caveats. Like I think it's really situationally dependent. So you can have a PT, and I had some great conversations with colleagues about this. You can have a PT with an SCS that is allowed to be on a field. Okay, what is their experience in that? So if you think about the education of an athletic trainer built into that program, whatever it is, like I have a bachelor's, that's what it was for me, now it's a master's, but built into that is hundreds of hours on the field. That's not full. And then hours are outside the field, working in the athletic trainer and working in those different settings. If you look at the programming for an SCS, you get some, but you don't get nearly as much. And so when you step onto a field and you say, hey, I'm the person covering this field, you are accepting a responsibility that whatever happens, like that's on you.
Yeah.
And so you have to make sure that you are truly comfortable with that. And so some PTs with an SCS are, because they've built up that experience. But I think coming fresh out of the end of your program, whether that's ATC or whether that's a PT with an SCS, I think that the athletic trainers can be a lot more comfortable on the field and having that. Now, I think if a PT with an SCS builds up that experience and now is on the field and being an active participant in that role in the organization they're in, and I think absolutely they're totally justified that they could fill that role. I just think we still need to work on building that out because that's newer in the field of physical therapy.
Yeah. I mean, you make a good point. Look, I get asked all the time, what do I think about chiropractic? And I'm like, it's a tough answer to give because, or a tough question to answer because there are great ones and there are terrible ones and there are ones that work in a setting that allows them to be great and vice versa. It sounds like you're saying the same thing about an NCS. Like just because you have those letters doesn't mean you're ready to do it. It's really person independent. We make a good point as to what the ideal AT should be able to do and why they would be chiefs. Talk to me about coming out of your bachelor's program. Maybe you understand a little bit if it's different at all of the master's. How much of a skill set or knowledge base does your standard AT have with the entire rehab process?
Yeah, I think it's good. I think that, again, if you think about the scope of an athletic trainer, it's beginning to end. And so you have whatever set amount of time your educational program is to cover that. Then if you look at physical therapy, you have the 2.5 to 3 years to cover rehabilitation. So obviously I think a physical therapist is going to come out with a more in-depth scope on the rehab because it's 3 years just to dedicate to that one thing. Yeah. But I do think that athletic trainers are coming out with a good baseline. And then it's kind of up to them to dive into what is their specialty. Are they working with the sports team? There's also a lot of opportunities like in industrial setting, in other situations for athletic trainers. So kind of like a PT is going to come out as a generalist then it's up to them to dive into those specialties. And it's going to be the same thing for an athletic trainer on the rehab side.
Yeah. Okay. So that makes a lot of sense. And I see a lot of ATs are going the way of like physician extenders, almost acting like a PA, where they're going in and doing assessments in clinic, which is a great use of the skill set. I think that makes a lot of sense. So you can definitely see them kind of go in multitude of directions once they're out. There is an existing territorial nature between PTs and ATs. Can you break that down as to why that exists and how you tear down the walls of that silo?
Yeah, I mean, I think a lot of it, which is most understandings, is just the lack of conflicts, is a lack of understanding and some miscommunications. So with the PTs coming with the SES and being to do on-field coverage, that was something that was pretty much AT's thing. Like that was them. Yeah, and maybe you'd have some EMTs or some other healthcare provider, but majority of that was ATs. So now you have PTs on the field coming over, and like we talked about earlier, there's a little bit of just like, you're going to be like, why is an AT doing rehab? And an AT might be like, why is a PT on the sideline? And so it's a lot of almost like a turf war between the two fields, I find. And then again, we're all so busy. Healthcare is a crazy field. There's so much more to it than meets the eye. To break down those walls, it takes time. It takes a lot of effort. And a lot of that effort is phone calls and meetings and emails and conversations to really establish those relationships. But I mean, we do it on a daily, weekly basis with doctors. And I think that's something our field could do better as PTs and ATs, is try to bridge that and try to make those some of our stronger connections as well.
Yeah. So walk me through how you would approach that. You have a athlete going back to their given Division I program. They're going to be under the care of an athletic trainer, not a PT. How do you broach that conversation with the end goal trying to be collaboration versus being territorial?
Yeah, I think first things first is I'm not using like, I know they should do this. They need to do this because I said so. So it's about verbiage. I go at it more at, hey, these are my ultimate goals for the rehab. So I'll start off, well, first, if it's a college athletic trainer, I'm immediately emailing them and trying to set up a phone call. If we can't understand, so we'll go for a pretty extensive email or text exchange, but the ideal is that we're actually talking. Yeah. And then it's, hey, look, I have this patient, they have this diagnosis. In my head, I need them to hit these 3 things, and that's what we've been working on. This is what I've done so far. I'd love to see them hit these markers. What do you think? And then it's less, hey, I want them here. I want them here. And these are the objectives, things I'm looking for. This is how I've approached it. What's your idea of that? That's if I'm, they're going on to college, maybe in a different state. If they're working in, I have some athletes right now who go to college locally. And so they work with their athletic trainer multiple days a week, and then they come and see me multiple days a week. That's a different story. That's a ton of communication. So again, I will email and ideally set up a phone call with the athletic trainer in the beginning. I want to first get that patient on caseload. And then it depends on the athletic trainer. I've had some where we just have an email string where we both send like weekly updates. I've had some where it's a little bit more of a volatile situation. So it's a daily text, and we just both establish like, you don't need to respond to me saying, thanks so much. It's just like the message, like we're exchanging objective data so that you don't overload, I don't overload. If you see something that day, you need to change the plan, easy, you let me know, and then I can adapt to that. It's very collaborative. And then they establish who is in charge of what at the beginning. I think that's important too.
Give me some examples there. What are they in charge of?
Okay, so a patient going to return to run, who's doing that? Right? Is it me? Is it them? Typically, when I'm treating as physical therapist in a clinic, I give my patients a return to run program that I have them do outside of physical therapy. So when they're in the clinic, I'm not just watching them run for a minute, walk for a minute. Yeah. So I'll be, hey, this is the program I use. What do you think about it? And then during practice, the athletic trainer is watching and monitoring the athlete. So that was more of a collaborative. When it comes to return to practice, I have a conversation. These are the percentages I'm thinking. This is the kind of drill I'm thinking. But then that's ultimately up to the athletic trainer because they're getting the practice plan from coach. I'm not.
Right.
They're going to be able to make a better decision than me, truly.
Yeah.
Not from their AT out of PT, but they're in the moment right there.
Yeah.
So then I pass that on to them.
I think that's where PTs kind of get a bad rap, or where it creates some tension where it's saying, I will make the decision to do X, Y, and Z, whereas the AT, to your point, is there, boots on the ground. They're able to do that. So it sounds like you're building consensus around this athlete and getting objectives by sharing some of your liabilities, sharing some of your powers, and what I want you to do this. You're better equipped to do this. And I think that probably kind of puts the AT at ease to allow some consensus. Don't only tear down some of those walls. Can you give me examples of collaboration of ATs that went awesome and some examples when it didn't go so awesome?
Yeah. So the one region I had, again, local college athlete, ankle injury, which is super necessary to have someone boots on the ground there because, as you know, like returning to a cutting sport, that's tricky for an ankle. And so that's one of the ones where we established that we had a weekly email string, and then we would just text each other pretty much on any day.
Where did you get this idea?
Honestly, it was just a conversation with the athlete as well, where she was feeling overwhelmed and not sure how to manage all of that. And so I saw that happening and was like, okay, why is she overwhelmed? It's because she doesn't know how to communicate these things. How can I alleviate that stress? I need to be better at communicating.
Yeah. I think that makes a lot of sense. Okay, so that went well.
That went well. When it doesn't go well, it was so much trickier, obviously. Yeah, definitely had an athlete go to a college that was not as local. Wasn't getting a ton of response from the athletic trainer, which again, I think is one of the biggest issues, is that lack of communication. And then I'm getting reports back from the athlete, saying maybe they weren't as comfortable. And that's a lot tougher because I can recognize that each individual has a different way of rehabbing. I don't rehab the same as you, Yoni. You don't rehab the same as me. I think we're both pretty good physical therapists.
Yeah, okay. Yeah.
And so, but again, lack of communication is tough. And so in that case, what I ended up doing was giving the athlete, again, like themes and overall goals. And we talked about building out a gym program or something like that. And then even if I don't get a response, I continued to email the athletic trainer just so if they were reading it, I don't know, maybe they were, they had that data.
By the way, also, it's the CYA. God forbid something goes wrong, there's a nose paper trail of your line of communication. And I think that's a piece of advice to our newer PTs or even the ATs that are listening is take your ego out of this. You don't need a response necessarily. You don't need them to pat you on the back. Hey, you're doing a good job. Who is the focal point? It's the athlete. And what is best for them is for you to provide as much communication as possible and to be as humble as possible when doing. I think that goes a really long way. So I think it's a great way to handle it. Did you ever get a hold of the AT? Did the AT get hurt or something? No. Okay, what do you do? Because I'll run two-faced by it. Local powerhouse high school has in-house athletic training, no signs of a PT for miles, says to the athlete, hey, you tore your ACL, you need to rehab here at the school. I don't want you going to your physical therapist. How do you handle that when that's relayed to you by the patient?
I think it's super important to...
I feel like you drop a bunch of F-bombs when that happens.
But I think you need to do that internally.
Okay.
I think a really big point, right? Because the last thing you want to do, again, who's the focus, the athlete, is you start, saying, oh, that's a terrible idea, they're the worst. Well, now you're putting the athlete in the middle of a conflict. And if we're talking about powerhouse high school, that kid is no more than 18, maybe 19 years old. Like, they're barely an adult.
Yep.
So why are we putting that in that position of two adults bickering over a turf war? Right? Like, that's not it.
Yep.
And so the first thing you have to do is internalize that. Then, again, I really think that you have to go as, hey, not it's in what I personally think this is what the data shows. We need to get a 90% QR. You need to get this. Like, come in and we'll at least do tests and measures and build that in without that emotional component that you're feeling towards telling your individual. And I think you'll have a lot better buy-in from the athlete and then maybe be able to work on that relationship with the other healthcare provider.
Yeah, great point to keep things objective. I think the subjective nature is the F-bombs. Your opinion on how the AT is going to look. That's not really important. What's important is you're the goals of the athlete. As long as you're reaching them, I don't care where you're reacting and how you're doing it. So I think that makes a lot of sense. I could have used you way earlier in my career. Okay, how about this? Because this was a massive challenge for me. I was working with an NFL athlete. I got a phone call from their head athletic trainer. I think he's an AT, might be a DPT, but he's their director of sports medicine, and says, "Hey, heard you're working with this guy. Send me all the notes. How's he doing?" What do we need to know in handling that conversation, first of all, to start?
Again, I think like if you know that person, where are they coming from? Are they trying to pull it from you, or are they just trying to get more information?
Do I need to check with the athlete as to whether I can share that information?
You should, however, because they're a healthcare provider and they're part of that organization. Like that is something that athletic trainer is going to need to know, is that they'll be rehabbed for something. Mm-hmm. So imagine that, right? Someone coming into the physical therapy clinic and someone else knew that they have this underlying issue and the athlete forgot to tell you, like that could change your plan of care. And so yes, like you need to tell that athletic trainer that information, because that can affect their ability to provide a good and accurate care to an athlete later in the line.
Okay, so you make a good point, because I think when the athletes are playing professional ball, at least at the NFL level, they sign some type of waiver that says you need to share my information with in-house providers. If they don't have that, and the athlete says to you, I don't want my team to know about what we're doing, do you have to share that information? Or you have to respect the patient's wishes?
So that gets into the legal stuff where I would have to, if that was that specific situation, I'm going to have to dig a little deeper to give you a really solid answer right now. Okay. Again, I would have to dig. My understanding is if it is another healthcare provider that needs to know that information, I believe you can share that. But I would give you a really solid answer. I have to dig deeper on that.
Okay. His follow-up, this athletic trainer's follow-up to me was, hey, are you also seeing this athlete? What do I need to respond to that?
Yeah, that one's a little tougher, right? Because the one comes to you knowing that you're seeing it. And so most likely then, again, the athlete has conveyed that, right? Like if you're just out having a coffee, you can't say, by the way, I see tell him so. That's a direct violation, right? So in that situation, I wouldn't say anything. I would say, hey, like, why don't you talk to them, see what they say, or what I need to gotta respect the patient confidentiality, and then start with that conversation. Ideally, then, if you are seeing that other patient, you bring that up. Hey,
to the athlete.
Okay, does your athlete trainer know you're coming? Like, what's going on there? And it's good also to meet your life user, and again, forearm focus, which is the patient and the athlete, give them a little bit of a boost. Hey, your entire healthcare circle should know what you're going through.
This is why I appreciate having the conversation with you, because you've seen it kind of with both sides. So like if you're at, where do you get bachelor's?
University of Vermont.
Vermont. Okay. So like if you're the AT at Vermont and an athlete of yours goes elsewhere, it's just interesting to hear that perspective that it is there. It kind of everyone knows. In making the picture of the athlete the focal point. What do you wish PTs know about ATs and vice versa?
I think it's the scope. I don't think a lot of physical therapists truly understand the scope of an athletic trainer and the day-to-day tasks and responsibilities and time.
So tell me what it is. Tell me what they are. Because I get really frustrated when I see athletes at the highest level working with their athletic trainer who's in charge of their PT, of the rehab. And they are skipping steps. They are overloading tissues. They do not have an understanding of where the athlete should be here and where he's going. So what do I need to know about that AT?
Yeah, I think it depends on the level, obviously, and also the institution. So I've been fortunate enough to have experiences in a variety of whether that was as a student or professionally, and it depends, right? As always. Yeah. If sometimes an athletic trainer is responsible for one team, that's awesome. But then think about the roster size of one team.
Yeah.
That can really vary. You work with a tennis team or a golf team, it's a lot smaller. You work with a men's lacrosse team, that's pretty massive.
Yeah.
Football usually gets a few. So
Right.
I don't use that example.
Yeah. Yeah. But still, even then, it's like, I look at NFL teams and they might have 5 ATs,
Right.
but they got 9 guys in camp.
Mm-hmm.
It's not a great ratio.
No, it's tough, right? And so you are trying to work that. You're responsible for, like I said, from beginning to end. And on the side, you're responsible for keeping them healthy before they get injured of that many people. The other big thing is the timing, right? And so if you're doing treatment and you're doing rehab, if you're in a college setting, you're working around college classes, they're student athletes, right? You worked in high school for a little bit and school it out at 2:30 and sports start at 3 o'clock. That's crazy.
Yeah, that's
correct.
crazy.
So like, what am I supposed to do? So I have 30 minutes to see less than, because they got to walk to me. They got to change into their gloves. They got to get them out to practice. So I don't know, 15 to 18 minutes to figure out and triage anyone off to my work.
Yep.
And so like that's tough. But in a college setting, it's still the same thing. If you need to do pre-game or pre-practice treatment, when's the ideal time to do that? It might be 15 minutes before, but you have 15 guys walking in. How do you do 15 guys all 15 minutes before? You know what I mean?
Yeah.
So that's kind of tough. And then you have to build in the rehab component around their schedules. So you're usually as a non-negotiable trainer, you're showing up an hour, maybe 2 hours before a practice, definitely at least 2 hours before a game, if not more. And then you're there for the whole practice in the game, and then you're going to do post-treatment, and then you got to do rehab on the side. And that's just like the baseline.
Then you haven't even mentioned what I think becomes a massive onus on AT, that's the paperwork.
Right.
It's crazy.
Mm-hmm.
What needs, like, I'll get requests just for notes so they can process bills and like all this stuff that you don't really think about. So I guess if all of that is their responsibility, it doesn't seem fair. So number one, that colors the way I'm talking to an AT, like with a little bit of understanding, a little bit of grace, that they're not level on like we are.
Right.
So understanding that will make the conversation better. How the hell are they supposed to succeed?
It's tough, right? It's, but I think again, some schools and some systems have a great setup, and their athletic trainers get a fair amount of support where if they need help, they can get a little extra help, or they've established good systems for themselves. Good relationship with coaches, that's huge. That can also be a bit of a stressor. If you have a program that has a really well-established coach, you have a good relationship, a lot easier. You have a program with a lot of coach turnover or some difficult personalities, way harder.
Yeah.
And so that's going to be a lot tougher to succeed. But I've seen it done. Like I know some amazing athletic trainers that work in these high-level settings, and I respect them so much and learn so much from them. And
What made them better than the ones that we don't respect as much?
Yeah, I think that they were really honest about what they could and what they couldn't do. I thought that they set boundaries for themselves and their athletes really well. And by doing that, they really commanded the respect of the athletes being treated. And so the time the athletes got with the athletic trainer was really, really valuable and really well intentioned.
That makes a lot of sense. When I was working with Israel lacrosse, and I traveled to World Games, and I would put up a treatment list, and I screwed myself because I saw everyone was on that treatment list, and then all of a sudden I'm doing like hamstring stretches every goddamn day on the same kid, when it's like he could be doing that on his own. How does an AT manage that? Like once you stretch that guy's hammies, he's gonna want to come back and have that done again, your soft tissue or whatever it is. How do you handle that in an AT environment to make sure you're not getting like the hangers on that are going to eat up your time and now you can't lift the AT up?
Yeah, it's difficult. And you have to establish that early on. And I think a lot of athletic trainers will go into it, maybe not set a strict move boundary and then regret it a little bit later. And I'm guilty of that too. Some of the first times I worked with teams, I just wanted to like get buy-in. Yep. So I told it stretch to everyone. And then, I was off down. So setting some boundaries, I think a good practice is I don't mind doing a little stretch, but then they have to finish with some independent work. So it's never a solo, I just do some passive modality and then they leave. It is always paired with, okay, now this is how you do it by yourself, or okay, that's fine, I'll stretch you for 30 seconds, but then that's followed up with an activation and an active mobility. And then you adding this to your warm-up because you need to be stretched. That means there's something wrong. If there's something wrong, you turn alter plan. So I try to establish those as my rules. And then when someone comes to get stretched or they come and need some passive modality, which isn't a bad thing, they have a better understanding, and they're only going to come if they're willing to put in that work.
Yeah. Okay. That's really good advice. What was your day-to-day like managing Mexico lacrosse and Hungary lacrosse? How did you do that in one person?
It was crazy, but it was so fun. I got really lucky that the way the tournament worked, they alternated. So either men's were competing in morning as a Hungarian men's team and women were in the afternoon, and that was Mexico's women's team.
Women's treatment.
A little different, right? So that's a tournament setting. So we were in a 4-day tournament, like 3.5 days. And so there wasn't as much treatment. And some of these individuals I was meeting for the first time.
Yeah.
And so we did a lot more like pre-game stuff. And then I would give some more general advice. And then I was available if specific people needed to reach out. So it was a little bit different in that setting. If I'm at World Championship and it's a lot longer, where that's on 2Es, I set up treatment schedules. Like you're saying, I will assign certain slots. So I'll put them all out. And then the people I know I need to see at certain times, I'll already insert them in, let them know that's when they're coming. And then sure, if someone else has a question or they want to come, you can sign up for another slot. So that's how I do it.
By the end of the tournaments that I've covered, I want to hang myself. Like there is no downtime for an athletic trainer. Or like that's kind of what I was functioning as, or a PT. How do you safeguard yourself from burning out in those situations?
I think right now my setup and what I'm doing is great because having a little bit of stability in my 9-to-5 job is good. And then I think it's so much fun. I think the times are fun and they stayed fun because I'm able to do it maybe a little bit less frequently in that insane timeline schedule. So then when I do it, sure, I'm working 6 a.m. to 11 p.m. with little breaks in between, but it's for a short period of time. It's great. Again, I think that scheduling thing helps. I always schedule and track myself to move, whether it's like a run or a workout, and like really block those off.
Yeah, you gotta own those things. That goes back to your boundary idea.
Yeah.
Even if it's just to eat something like that, right? To like carve it out. Talk to me about taping ankles. Where are you with taping ankles? Why is that the calling card of an athletic trainer?
Because it's not something you can just Google and do.
That's definitely true because I've tried that. Does it help the athlete? Where are we with the science of ankle tape?
Yeah, right. There's like some stuff coming out where with white tape that it's going to loosen, as soon as 20 minutes into it. But it can be a lot more specific than a brace. So I don't think a combination is bad of like a light ankle tape, no such thing, but maybe not as much tape on it. With a brace, you think that, I also think it depends on the tape you use, right? Like a lot of athletic trainers now aren't just using white tape for an ankle tape. They might throw in maybe some leukotape or something else that gives a little bit of more support on one area. I was listening to the podcast and they were saying like there's no such thing as a loose ankle tape. Like it has to be tight to work. So that's another thing, your education on it. Yeah.
There's a lot there. Is it worthwhile enough that PTs should be learning the taping methods?
No, I don't think so because it loosens and
so my ATs do.
Because again, their boots on the ground, right? So if I have an athlete going out for a game, I get some this weekend where they posterior ankle sprains, were having some pain, wasn't feeling that good. One, the tape added a little bit of compression, so that gave them a lot of external stimulus on that joint that they were not feeling really confident with. So there's one aspect that I don't really mind giving them, right? And then it did give them a little extra support. I did it right before the game. They went out. I can redo it at halftime, or I can add in a few extra pieces of support at halftime. Again, I'm there, so I can adapt to that. I don't think a PT working in a clinic needs to know because they're going to tape them and then the athlete will go to practice 2 hours later.
Yeah.
That ankle tape isn't doing anything.
Okay, where are you on KT tip?
I don't
Don't believe it. Okay.
Well, let me clarify, right? Like, what are you using it for?
I'm asking you.
Okay.
What do you use it for? Sit
So
heel.
I don't really use it. The only time I use it is if you have a little bruise, I'll do a little octopus tape where they cross it. And that actually is pretty effective. And at least reducing a little bit. I'll even use it on some post-op ACLs to get that on the back of the knee. I guess I can argue that it gives you a little bit of extra external stimulus. It is so light though that I think that that's gone after a bit. I would rather, if you need that, I will actually end up using a stronger tape. Like if I'm using it on my shoulder, I'm pulling out my Luco tape. If you're talking about like a postural direction, sure, you're gonna need a little bit from the KT tape. But if you're in a game, running, sprinting, sliding, dodging, getting checked, it's not coming up. You don't feel it.
Right.
You have so many more stronger stimulus coming at you. There's no way to that.
Yeah.
So in that sense, I'm not really a fan of you're doing it to like correct the posture to bolster.
What about lacrosse tape for the knee?
Yeah, so actually I've done it. Okay. And that's a much stronger tape.
Okay, so then they're using like a thick Luco tape or white tape. You ever use kinesio tape for that?
No.
It's really crazy. I did World Baseball Classic with Team Israel in Korea and Japan. I was really interested to learn what their Rehab world is like.
Mm-hmm.
They are, I hate to like put people in buckets, but the Korean physios, like they had Luco tape like coming out of their ear. Not only but they had kinesio tape coming out of their ears. It was like, that's all they did. Your shoulder hurts, what's kinesio tape? Your ankle hurts, okay. Like everything was kinesio. I feel like we've seen like back and forth. Like it was hot like in a school 15 years ago. It's kind of gone away. Have you seen any trends of it coming back?
Yeah, I mean, I don't think that there's like a day in the world of athletic training I've not asked about KT tape.
Okay.
That's fine. I mean, they're really good at marketing.
Yep.
You know, it's like Michael Phelps with the cupping.
Yep.
I think there's a time and place for cupping, but all of a sudden everyone thought cupping was going to save them.
Yep.
KT tape is super visible. It's bright colors. Everyone has it. You see it kicking out of someone's jersey. Ooh, what's that?
Yeah.
You know what I mean? And so it gets a lot of buzz.
Yeah.
So I think it's totally normal for people to ask, why wouldn't they? And then I just educate them on, hey, why do you think you need KT tape? Is it because you think you need KT tape or you have something that's bothering you? And then let's get to the root of that problem, and then I'll probably have a different fix.
I really like that outlook because I think people become too militant about their toolbox. Like, it's never your SI joint. It's always your SI joint. We're going to ankle take everything. We're going to case it in. And I think like being fluid with it is a really important skill. And that's like another plug for the positives of ATs is that you're limited by time. You got to make really important decisions. And sometimes it's better to put KT tape on that person than have a 20-minute conversation with them about it. But you're really becoming a fast thinker, on your feet. So I think that's great. Tell me about what you do in what I love that you refer to it as this, your 9 to 5. Like walk me through what that world looks like for you.
Yeah, so I treat one-on-one, which is super awesome. We treat one-on-one for 45 minutes, as you know. It's great. I have a really cool range of patients. I love seeing them all. I have people that have full-time non-athletic jobs, and they really like to stay active, and they come and see me. They have some aches and pains, so they have an injury, and they're like, I don't want to just sit and be okay the rest of my life. I want to thrive, so I have a bunch of those. I have some high school athletes right now. I have a bunch of college kids coming back. I've already gotten a bunch of texts. Yeah. They're on their way, or they're already here. And I do that 5.5 days a week. I'm also the clinic director. So it's like so I run the Twonium Clinic for True Sports. We have 6 full-time physical therapists. So I'm in charge of the operations of that particular clinic and building that up. And so that's also part of my time.
So I want to get into that role because we talk so much about what you do clinically. Mm-hmm. It's really fascinating to me the way you blend AT and PT. You're the clinic director of our busiest clinic. What prepared you for that role? What are some of the challenges in that role?
Yeah, I think some of the challenges is we have 6 really awesome physical therapists. And I think True Sports Listening Company has done a really great job in building up almost 6 different personalities and different physical therapists to make it really well-rounded clinic. So there's a PT for every single person that walks in the door. And that's awesome. but that's also managing 6 different types of people. So that can sometimes be a little challenge. I've been being an athletic trainer helped me out because that clinic is always changing and there are always fast decisions being made. And again, 6 people, so that's 6 individual careers that are changing, and this happened with a patient, or this happened with Billum, or this happened and they need some guidance. And so I have to be there to be ready for that. So a lot of quick decision making.
It's interesting because you're one of the first leaders, I want to say, in the company that moved into that role, not because you are the best clinician, although you might be, but because we thought you would be a great manager, a great clinic director. What do you think you did to prepare yourself for that? Like, is there any leadership training or work you did on your own to prepare you to have tough conversations that is outside of your athletic training background?
Yeah, I mean, I think I've always tried to put myself in leadership positions. I like to talk.
Where's that come from? Not to talk, where does that come from, like your quest to be a leader?
I think I've always seen if there is a problem, I don't really like to sit there and watch it. And I don't like to sit and watch and complain. If I'm going to see if there's something I'm not comfortable with, I like to be part of the solution. Otherwise, it doesn't feel good to me just to sit there and notice it.
Why?
Because I don't think that if there's a problem, I don't think you should be like sitting there wallowing in this ugly feeling if you're not taking an action, whether that's having a conversation or like going out and being a leader in actively trying to change that, because that takes away a lot of your independence in the situation.
Where do you see that? Did you see that model for you in your education? Is that from home? Like,
definitely home. My parents are amazing at that. And their big thing was like, there's never a problem you can't get through. It might not be the way you want to, and it might be uncomfortable, but you can always get through a challenge, and you just have to figure out how, whether that's you doing it or you finding support to get through it. So they were massive role models for that, and definitely pushed me and my siblings that we don't let things just happen. We want to be part of that solution.
Are your other siblings in leadership goals also?
Mm-hmm, definitely.
In?
My sister's in education and my brother's an engineer.
And they lead teams?
Yeah.
Their parents did a freaking good job. What are some of the challenges of that role, specifically clinic director?
I think it's just the volume and lots of moving parts. So it's honestly just making sure you're remembering all the moving parts and all the different aspects of it. So there is the business side. Are we seeing enough patients? Are we able to keep the lights on? Are we able to keep paying our PTs really well? And then there's the patient side, but the patient's getting good care. What could make their care better? And then again, there's the individual management. Are all of the PTs in my clinic, are they enjoying themselves? Are they not burnt out? Are they fretting? Are they pushing themselves to be better every day? So it's managing all that, plus like any extra projects within the company. How do you
keep track of all that, first of all?
A lot of notebooks.
A lot of notebooks, handwritten notebooks?
Yeah. All this person.
Okay. And how do you know if your team is trying to get better every day?
Communication, right? It's been really awesome in this company. We have monthly meetings. So I get to have a one-on-one meeting with each one of the staff PTs every single month. And that's huge. So it's a moment that we get to check in, and I try my best to make it a lot about what their needs are. I always have agenda items. There's always stuff coming up, but there's always time in those meetings for if they're working on something, there's a concern for them. We have that, and then I'll come in with goals, and we make action lists going into the next meeting of, okay, what am I doing coming out of this meeting until I see you next? What are you doing coming out of this meeting next? And we've just implemented some goal strategies, some more formal check-ins. So I'm hoping that will also make out a bit better too.
That's awesome. I mean, that speaks to preparation. It sounds like you take time before each meeting to review agenda items to figure out where you are relative to your goals from last month. So that's great. And that can certainly go a long way. You took over a clinic that I think it was five PTs when you took over. It is 6. But you took over a different leader. Mm-hmm. So walk me through how you navigated the culture that was moving it towards the culture that you wanted it to be.
Yeah. So I think in the beginning, a lot of it was just transitioning, making sure nothing flopped in that transition. So I keep my head above the water. And then once I felt a little more established in a role and I could get the sense that the other PTs were comfortable with me in a role because I was staff PT at this clinic and then became a clinic director. So these were my direct colleagues prior. And now I'm with clinic director. So once we were there, then I worked with my regional director to set some goals. And again, I did the same thing I asked my staff PTs to do. I make goals with timelines, had action items, and then it would do weekly or bi-weekly check-ins with myself and my regional director on, am I hitting those goals? What steps am I actually taking to do this?
How did you handle the fact that you were a staff PT? You were an equal, for lack of a better term, as a staff PT. Now all of a sudden you're their boss. How do you navigate those waters?
I mean, looking back, I think I could have done it better.
Okay, why?
I think that I think that I wasn't as strong in like establishing that before because I was nervous about that transition. And so I let some things happen where he was a little loosey-goosey and I just kind of let it go because I'd heard us, 2 days before, like we've been chatting about something like that beforehand. And so I was nervous to be a little bit stronger in some of the more uncomfortable moments of maybe, hey, like these numbers are low or this is not something we want to be doing. And in the beginning, I was not strong on that. And then in the last few months, I think I've gotten better at that. I've definitely reached out to some mentors to be like, hey, I need to have these difficult conversations. I'm not a big fan of them. Do you have any advice on how you go about it? And really reflecting on that.
What was some of that advice?
That it's going to be uncomfortable, but being uncomfortable doesn't mean that it's bad. And this is how you move forward. And if everyone is just happy all the time, they're probably not. And then also your company won't move forward. And you unfortunately notice that when it's too late.
Being uncomfortable doesn't mean it's bad.
Right.
I love that. We gave you that advice.
My dad and my mom. And at the pretty great
Does. That's really good kind of food for thought. What are some of those, I guess, if you can give specifics, what were some of those sticking points with staff PTs? And how did you create consensus? You're such an outstanding consensus builder. How did you get them to see we do need to get better? This does need to change.
Yeah, I think it was learning what made them motivated or what makes them tick. So figuring out what was the sticking point of like, why should they care, right? So I'm getting all this information from others in the company and I know I need to care because again, I'm responsible for the operations of the clinic. Why does that matter to them? And so figuring out like, what motivates them and where they're coming from in terms of where they want to go with their career, what they find value in the day-to-day in this job and in this role. And then how can I relate some of those things that I need them to do more on? How do I relate that to their goals? And then pulling them in and honestly being honest. Hey, this is something like I'm tasked with and I can't do this alone. This is a group situation. I need your help. I really was like, look, like we're teammates and I will support you, but I also need you as my teammate to support me. And this is one of those instances where, yes, I'm your boss, but I'm asking for help.
Yeah, that's great advice. It's also, and it's really clear, like the way that clinic functions, not only is it 6 different personalities, but it's also an environment that's loud and busy, sometimes aggressive. But that's where athletes want to be, right? And so it's just an unbelievable job of bringing like a sense of calm to the PT side of things. And I think that's something that listeners can think about is regardless of the environment that's around you, how do you make the people in that environment feel a sense of security, a sense of calm? And what do I need to do to get to those levels or to achieve those objectives? I think it's really clear they've done that in Zamilio, and you come a long way with it. It's awesome to see. Okay, looking back, anything you would have done differently in your education or career path?
I don't think so. I'm sure I could think of something, and there are definitely days where I'm like, should have gone to PT school, Should I have done the athletic training? Should I have tried and part of this internship? But at the end of the day, I think I've learned so much from everything that I did, and I have made such amazing connections through every part of my career that I'm going to just say no.
Okay. That's a very safe answer. If you were, not the answer I would get for my own career, but if you're coming on to AT school, right? You're at Vermont. Did you work in between AT and PT?
No.
Where would you be today if you didn't have a PT background, PT education? You're an athletic trainer, where?
Yeah, I mean, when I was applying to PT school and thinking about it, I went into undergrad thinking I wanted to be a physical therapist. That was my initial goal, and then I actually found athletic training while applying to PT school. That's where my first shadow was an athletic trainer because I had never been like that badly injured, so I didn't know who anyone was. And then I was like, wow, about this. So in thinking that, I definitely think my thought was college or professional sports. And then I went to PT school because I wanted to be stronger in the rehab setting. Also, some of my mentors at that point were dual certified individuals. That's actually mostly how I got into that track. And they had done work at professional levels. So that's what I knew about dual certs. And so that was kind of my goal. Obviously, that is a slightly switch. I still work with professional athletes, just in a different setting than I thought it would be. But yeah, that's kind of where I was.
And how do you keep up with those two certifications? Like, how do you do continuing ed for AT and PT?
We do a lot of research on which CEUs
cover both. Okay.
Yep.
Okay. That's really smart. If you're I hate to say just an AT now, but if you're an just an athletic trainer now, how much money are those guys making? And what's their life like?
Not a lot. And when they do it, I'm on the Senate, right? I mean, a high school could, I'm sure that there's some lower, but like a high school might be the 40s. College, 60,000. There are definitely colleges that are higher than that. There are also colleges that are lower than that.
In PT? I mean, pros?
Less really on that because that's not as well published.
Okay. I think from what I know, they're making six figures. Mm-hmm. When you boil it down per hour, it's bananas.
Oh, it's not great.
I mean, those, like, thinking about like our local pro teams, they'll go on a road game. They get right on a plane coming home. They land in Baltimore. Players go home. ATs go to the facility. Mm-hmm. And then it just starts again. It's crazy. They're making up pennies an hour. It's a rough gig. It's really a rough gig. You gotta freaking love it.
Yeah, I'm nervous for the profession of athletic training.
What is going on with the profession? Because I get hit up constantly by whoever, whether it be like lacrosse workshops or like private schools. We're looking for AT. Where are they?
A lot of them have switched to physician extender. That's going to pay a lot more. It's less, like you're saying, it's a lot better hourly if you break it down. You don't have to work weekends. You don't have to work nights.
Yep.
So there's a lot of switch right now in the field of athletic training to those different types of role. Maybe an industrial setting, something like that was a little more stable. Because
otherwise it's freaking brutal.
Yeah, I mean, it unfortunately, like most things comes down to money. Yeah. Right? Like I've talked to people and they're like, yeah, we really think having an athletic trainer here is a really good idea. I'm great. Showcase. I'm like, all right, but what were you thinking for hourly? And you're like, we were hoping you'd volunteer. And I was like, okay, like I love it. And I volunteer a lot overall, but like, that's crazy in my opinion.
Yep.
Right. Or again, you have high school or college. Okay. So you think about a big college, right? That has a big sports budget. Never run a college sports budget or I don't understand all the intricacies, but you're going to pay your athletic trainer $60,000. And there's no way that you could figure out a way to get them a little more. Yeah. But you're not gonna get good quality candidates because you're not offering a salary that's measured to their experience.
I think you're right about that. By the way, I see that in the pros though also, because I'm looking at some of the rehabs I see coming out of the NFL, and I'm like, what the hell is going on here? that level of care is not commensurate by and large with the level of athlete. And I think it has a lot to do with that. Like, why is a stud PT working in-house for an NFL team other than that really gets them excited? It's not for money.
It's not.
No, you can definitely do better on the outside. So I think there's a lot to learn from that. I could totally see why you kind of went this road, that you're able to do so many different things in your role. You're able to be a leader. You're able to be an outstanding sports PT. You're able to be an athletic trainer with some of the best athletes in the world. So you're able to like check so many boxes. It seems like a great way to. Okay, let's shift gears a little bit. Ready?
Yeah.
Lightning round, because you're one of the most fascinating people I know.
Okay.
What's the one thing you're taking on a beach vacation in 2 weeks?
A book.
Okay, thank you. What book? I'll name the book.
I'm a historical fiction person. I know the top.
Okay. So, what time period?
I like a lot of World War II.
Really?
Yeah. There's also a lot of historical fiction written in the time of World War II.
Why don't you just read history?
Because it makes it a little more palpable. It's fun. It draws me in.
What was your response to what I always say about historical fiction? My response is, or what I always say is, how do you know what's real and what's not? So if someone comes to you and says like, hey, what happened in World War II? You tell them some like love story that's totally made up. Maybe the facts are made.
Have you ever read a historical fiction book by a really good author?
So I need to do that?
Yeah, because they have a big old author's note at the end of the book that describes the research process. Come on. Don't hate on the historical
fiction. I mean, you changed my name. I go on ATC, so it came out of this. What book do I need to read? What's my starting point?
The Rose Code by Kate Green.
Not reading.
Okay. It is about female code breakers in World War II. Yeah, it's pretty cool.
Okay, it's fascinating. Well, what's that? What sign was Verdale?
The good.
What is something you wish your 20-year-old self knew that you don't know?
That not everyone is, not as many people are thinking about you as you think they are.
Ooh. Not as many people are thinking about you as you think they are.
Yeah, I think I stunted myself a lot by getting so worried about what other people thought about me, even professionally. And that made me lose some of the confidence I'd built up. I think that stunted my growth professional.
How'd you wake up to that? That not that many people they do that.
A lot of trial and error.
Okay. What's your favorite beer?
Ooh, so I brew my own beer.
The first.
And I just made a Belgian triple, and it's pretty good.
How'd you get into throwing your own beer? How the hell do you have time for that?
My dad brewed beer, and so I brewed it with him, and I thought it was really cool. And so I grabbed the stuff myself and tried it.
And if you have to buy one mainstream beer off the shelf, it's what?
I left-hand milk stout.
Ooh, good answer. That's the one thing I'll drink.
Okay.
I shouldn't say that. Not the one thing I'll drink. I'll drink a lot of vodka, but I do like milk stouts. Okay. Which, by the way, they had maybe Nunna at Oktoberfest.
Yeah.
They just like don't drink that heavy dark beer.
Yeah.
I don't know why that is, but I guess because you can't drink 40.
You can't drink water.
Your goals for 2025. You're a big goal person.
I am a big goal person. I have a few. One is obviously to read a certain amount of books. 40.
What?
I read 22.
Come on. How big are these books?
I mean, I don't know, between 300 and 700 pages.
What percent of the words you actually read?
100%.
Get out of here.
Fast reader.
Chief. Okay. God, I really feel bad about myself. Okay, 40.
Yeah, 40 books.
Okay, what else do you got?
I'm running marathon in October.
How many marathons have you done?
3.
Anything that's going to make me feel better about myself?
Let's see, what other things are on my list? I don't know. Try to save some money. Go on a trip next year. So that's a good, yeah. You're probably better at that than I am. Way better, actually.
Decent save of money. Okay, well, Kenny, you've taught me a ton, and I knew you would. Would love to have you back on. What's the topic for our next one?
Ooh, that's a good one. I don't know. Maybe how to tape an ankles.
How we can get a podcast though?
Lots of communication. You'll work on that communication.
I do need to work. You've been an awesome guest. Thank you so much. Tell everyone where they can find you.
So I'm on Instagram at KLennon_DPT_ATC. Yep, that's my goal.
Okay. Love it. Thanks for doing what you do every day in your 9 to 5. And also thanks for like spreading a word about ATs. I learned a ton. The fact that you're constantly doing it is really a credit to you and a credit to your entire staff. So keep it up. Don't screw it up. Thank you everybody for listening. Let us know what you loved. Let us know what you hated. Find us on True Sports PT. Bye-bye.